HealthLink on New Day Northwest is sponsored by LifeWise Health Plan of Washington.
So if you don't have health insurance through your company or you're in business for yourself, it's time to renew your insurance. Open enrollment begins on November 15th, and many people have a lot of questions as we head into the second year of the Affordable Care Act. Here to help us sort things out, please welcome Nicola King from LifeWise Health Plan of Washington. Thank you for doing this.
Thank you.
Okay, so are there any major changes to open enrollment for this second year?
So 3 key things to think about. First is you have less time this year. So open enrollment this year is only for 3 months, so take some action soon. Second thing to think about is that penalties and subsidy amounts will change. So if you looked at penalties and subsidies last year, those numbers are going to be different this year.
So go ahead and take a look at the whole landscape again this year.
Absolutely. And the third thing to think about is this is your chance to make a change. It's also your health plan's chance to make a change. So make sure your coverage is going to still give you what you need for 2015.
Okay, so you've got to read through the policy, make sure you understand. And I remember that last year we talked about the fact that you can call the insurance company and ask all the questions you need to ask about your particular prescriptions, et cetera, et cetera. So we can still do that. What are the key dates that Washingtonians need to know?
Okay, 3 key dates. Open enrollment starts on Saturday, November 15th. It finishes on February 15th, so you've got 3 months to make all your choices and get them locked in. And then the third thing to think about is the last day to sign up for benefits, if you want them to start on January 1st, so you want coverage for 2015, is December 23rd. So make sure you take some action then. And I would say, I know it says every time I come on this show, don't wait till the last minute. You do not want to be that person in that really long phone queue waiting to try and get stuff done on the very last day.
Plus, it's like right before Christmas, so you're going to be probably spazzed anyway, so just, please try to get ahead of it. How can you renew your current health plan? If you like the one you have and you just want to go with that, what's the best path?
So it really depends how you signed up. If you signed up for a plan through a health insurance company directly, you can probably do nothing. Your health insurance company will write to you should get a letter in the next week or so, and explain to you what's changing on your plan, how much it will cost you next year. So if you're happy with what your current coverage is doing for your family, do nothing. It will roll over in January. You can be happy and you've got coverage.
Good. All right, that's nice.
If you signed up through Washington Health Plan Finder, you probably do need to take some action. So they'll also write to you, or you can log into the online system, and you should be able to see very easily what things you need to do to make sure your coverage is in place for 2015. But as I said earlier, there will be changes. So make sure those changes are right for you. And also, if you had some unexpected costs last year, or if your plan didn't cover what you thought it was going to cover, this is the chance to really think about, is there a better plan for me? And I would encourage everyone to really think about that. And if you've got questions, do call your health insurance company.
Okay.
They may have other options that better suit you and your family.
Okay. Explain to us what the subsidy or tax credit is.
Mm-hmm. So starting last year, people can get help from the government with paying for their health plan. And the subsidy, what it does is it reduces the amount you pay each month for your coverage. And that's based on your income and how many people are in your household. Now, the subsidy amount changes each year. This year, for example, if you're a family of 4, for example, then you could get a subsidy if you have a household income of less than $94,500 a year. You can get that subsidy by signing up through Washington Health Plan Finder. And it's important to know, though, you can also get it through some health plans. They can help you do that process. But always ask the question. So around half of the people in Washington signing up could be eligible for a subsidy. That's a lot of people, so make sure you ask that question, make sure you talk about your income levels and who you're covering, and see if you can get some help.
And so there are penalties for not signing up for a plan, right?
Absolutely.
What are they?
So the penalty again increases each year. This year, in 2015, if you go without coverage, then when you come to do your tax return at the end of the year, you could be liable for either 2% of your income or about $325 per adult in your household, and half that amount for children. And you'll be penalised whichever is higher. So if you, for example, are an individual, and say you're making $50,000 for the year, you could be facing about a $1,000 penalty if you go without coverage.
In addition to not having health care coverage.
Absolutely. So the important thing to think about is if you get into an accident or have an illness, you could find yourself on the hook for a pretty big bill as well. And after February 15th, you can't sign up for coverage if you suddenly discover you have a health problem. You need to do it now, or you're going to be locked out until the end of the year.
Well, and 3 months is still a good long time to go through something like this. It's not like it's 2 weeks. We just need to get started on November 15th. Okay, what other things are there to consider this year that I may not have covered that we need to know?
So I think the really big thing is, Last year was the first year health plans had to offer these plans, and consumers have been giving us a lot of feedback throughout the year about things they want, things they don't want. So all health plans will be making some changes. For example, at LifeWise, we had a lot of people talk to us about which doctors and hospitals they wanted to see. So we've expanded our network, and now we have a bunch of new hospitals and doctors that are included in our plans. And that was a really big thing for us to do, because our members told us really clearly, this is the thing that's important to us. But health plans can also take things away. They can also increase the amount that it will cost you when you do go and get care. So triple check those pieces. And the other thing I would say is, a lot of health plans will give you like a spending report that will show you where you spent your money in the last year. Now that's a really useful tool to help you think about what coverage are you using and what coverage are you not using. And then you can use that to have a conversation with your family as well. Make sure you're taking advantage of what your policy does offer, and make sure that you're getting the best value for money for what you're paying for.
Very good. Okay, and we'll put on the website all the links and things that people need so that they can go forward. And you still have all the phone lines, right? So if we're not good with reading and I want to talk to somebody, I can call up and ask my questions.
Absolutely, and you can work with an agent or a broker as well. I think it's really worth finding someone to sit down, have a conversation about your individual needs, because reading something online is not the same as having that one-on-one discussion about what you need. True that.
Okay, thank you very much. You can find more information online about LifeWise and open enrollment. Just visit our website, and Nicola will be back as part of today's wellness panel answering your questions. Coming up next, procedures to help rejuvenate your figure if you choose, as Wellness Wednesday continues.